So I think we have a very serious problem. We are a terribly unhealthy country. It is bad for our work. It is bad for our play. It is bad for our family. It leads us all to be manic. It is a really terrible situation. So what I'm hopeful for is this is a wake-up call for all of us that we can come together in a goal that we want to be the healthiest country in the world. I just did my first panel, I have to say, and I'm not very good at, jumping in and making inflammatory remarks and like talking over people. So I need to get better at this.
America is overfed, overmedicated, and overcharged by a healthcare system that costs more than any other country in the world, but gets worse results and spends billions advertising medications that very clearly do not make people healthy. Something radical then needs to happen, and it just did. RFK Jr. is the new US Health Secretary, landing the job he traded for ending his own presidential campaign to support Donald Trump. Critics have variously described him as dangerous, unqualified, and a clear threat to US health. Supporters say it's past time to make America healthy again. Well, joining to discuss all this is the biohacker, Bryan Johnson, star of new Netflix documentary Don't Die, The Man Who Wants to Live Forever, Dr. Deborah Birx, who's the Trump former White House COVID response coordinator, entrepreneur and RFK supporter, Grant Cardone, and Francesca Fiorentini, the co-host of America Unhinged on Zeteo. Welcome to all of you. Francesca, let me start with you. RFK Jr. When I first interviewed him, I was very skeptical. I'd heard a lot of stuff about him being a crazy conspiracy theorist and so on. I've interviewed him probably 4 or 5 times since then, and I didn't get the feeling I was with a madman. I got a feeling I was with a guy who's immersed himself into health issues for many decades, that he has some opinions which others don't like, but that broadly speaking, he comes from a good place of wanting to make America a healthier place. What's wrong with that?
No, I don't think there's anything wrong with it. I think he is the picture of health himself. I mean, he's a roided up 70-year-old who doesn't believe in germ theory and eats roadkill. I think that is perfect. He sounds like he's speaking into a fan half the time, and he doesn't believe in vaccines. He wants to replace healthcare in this country with Ozempic. And he also wants to limit access to antidepressants and psychiatric meds for all Americans and replace it with things like meditation. If we think we have a mental health care crisis in this country now, just you wait until RFK Jr. is finished with this country. If you think there is some sort of drug epidemic, people are going to be buying Adderall on the black market in insane amounts. He also thinks that Jewish people and Chinese people can't get COVID. That was a fun one. You should tell that to my uncle. Oh, wait, he's dead. Also, 83 Samoans also dead from the anti-vax work that he did in American Samoa. Just as there's a measles outbreak in Texas right now because of the kind of lies about vaccines that he has spilled. But honestly, Piers, other than that, truly a picture of health.
Right, well, you certainly painted a rosy picture of the forthcoming health secretary. Deborah, let me ask you. I mean, look, you're a medical expert. You specialised in HIV, AIDS, immunology, vaccine research, global health. I remember you, obviously, centre stage in the Trump COVID era. What do you make of RFK? I mean, do you think he's dangerous? Is he misguided in some areas? Is he broadly right? What's your overview of him?
Well, we're finally having the discussions that we needed to have, frank discussions about the health of this country. I got to travel the country for many months during COVID, working at the state level and the community level. And what I witnessed was a lot of undiagnosed disease that could have been treated early, that then resulted in COVID deaths. And I saw a health system that had completely deteriorated in our rural areas. Our rural areas really don't have access to healthcare anymore. And the hub and spoke model that we had set up to get really sick people into the regional medical centers, they were overwhelmed themselves. So COVID pointed out a lot of our issues with chronic disease. Like with early HIV, when we started, we were only treating those with symptoms. Well, that was the tip of the iceberg. When we finally started working and finding asymptomatic individuals and getting them on treatment early before they had evidence of disease, they could thrive. So what I'm hoping is this is a moment we work with Americans to reverse those early signs of disease and prevent the progression. And then we won't have frank diabetes and hypertension and stroke. We'll have a very different outcome. I see you shaking your head, but I actually have data. And so data, I think, trumps. I'm right now in West Texas, was out in West Texas for the last year, documenting the number of people who have asymptomatic early diabetes. 58% in this community, a rural community that was picked relatively at random, 58% of individuals already had pre-diabetic or diabetic states, and another 60% were already hypertensive. None of them knew they were. They were all in their 30s, 40s, and 50s. This is our moment where we can actually tackle the issues that everyone has been ignoring for more than 2 decades.
But can I just ask the doctor? I mean, I'm surprised that you are a doctor. I believe in preventative medicine, and I think that RFK Jr. does a really good job of hiding the ball when he says things like chronic disease. I absolutely believe in that. The number one way to stop chronic disease is to have access to a doctor, to have regular checkups. 40 million people in Texas alone are uninsured. And a lot of them buy into some of the quack science that RFK Jr. is trotting out there, which is why if you were in West Texas, you should know that there is a massive amount of people who don't get vaccinations. And that's why we've got a measles outbreak right now. So in order to say, okay, you were the COVID, we know you're the COVID lady, right? I'm not trying to come down on you on that. I think you could have done a lot better of a job. You obviously were responsible for papering over Trump's worst wiles, like injecting bleach into, your system in addition to ivermectin. Please don't at me, all the ivermectin psychos. And, we know he liked you because you wore a pretty scarf and, you're nice to look at. And that's great. But you're also a doctor and you have a responsibility. So you have to tell the American people that it's the fact that they can't get access to affordable meds. They can't get access to a doctor without charging them an arm and a leg for basic things. If you need, let's say, a CT scan or an X-ray, right? If you have all kinds of just basic things, that you're not allowed to get that without being charged an arm and a leg. I've done work on this as a journalist. I've interviewed people who refused to go to the doctor because they cannot afford it. RFK Jr. does not believe in healthcare for all people. He says it's too expensive. Meanwhile, he wants to hawk everyone a bunch of supplements, and under his FDA, I'm sure a bunch of stuff is going to be approved of.
Okay, well, before I go to the other two guests who've not had a chance to contribute yet, I think it's only fair that, Deborah, you get to respond to that. So what would you say?
No, it's always disappointing to me when you have to degrade somebody to actually have a clear discussion. What I'm trying to be very clear on is there are people with insurance who are undiagnosed because they don't have time to go to the doctor because they're working 7 days a week. So we have to, in the medical community, adjust to people's needs. We can't do this one size fits all, that urban areas have access and a lot of rural areas do not have access. Yes, sure, insurance was an issue for a group of people and still remains an issue for some, but it doesn't answer all of our questions. And so just picking your specific argument and not recognizing that America is a very diverse country with a diverse set of needs. And what I'm telling you,
How will RFK Jr. make it better?
RFK is already making it better by having a frank discussion about healthcare needs in this country and the level of chronic disease and the fact that our food has all of these additives, which we know now. I mean, I'm sure you support the fact that the gut microbiome is critically important. And we've been abusing our gut microbiome for decades with these food additives. And now we know that our gut microbiome, which none of us in the 1980s when we were trained really paid attention to, he's waking people up to that issue of food, gut microbiome,
well, let's talk about food. I mean, really
okay, well, hang on. Let me bring in, we've got two other guests. Let me bring in Bryan Johnson. Bryan, great to see you again on Uncensored. We had a fascinating interview a year ago or so. This is all in your wheelhouse because you've gone on an extraordinary personal journey about health. First of all, what is your assessment of the state of America's health right now?
Yeah, I think the backdrop to all of this that's really important is that AI is advancing at a speed that is unfathomable to our current minds. We are bringing online the equivalent of billions, if not soon trillions of hours of PhD level intelligence, human intelligence, to find new discoveries about health and wellness and things that can improve our lives. And this cannot be understated. So as much as we want to debate an individual and their ideas, in the backdrop, the technological thrust and movement forward is just really the most powerful force in the entire world, that it will transform the way we think about health and wellness. I mean, over the past couple of years, I've become the most measured person in human history, proving that you can, in fact, measure the biological age of your organs in a robust fashion. That we can begin doing this for a very large number of people. So I think we're at a turning point in terms of the way we think about health and wellness, where instead of responding to symptoms, we can actually get ahead of it. And I think it actually answers a really important question. What is the West fighting for? I think it would be pretty cool if America said, we are going to become the healthiest nation on planet Earth, that we're going to have the longest lifespan of any country in the world. It's a really bold endeavor. It would be something that we could lock in onto. I think everyone benefits from positive health.
And what about RFK himself? Do you think he's a force for good, or are you worried about some of the stuff he does and says?
He is an atypical person in the job, you know, and there's a mixed level of opinions of his, but that's true for anybody. If you bring anyone into this position, there's an easy way to take them down. You know, he's well-intentioned. He has different ideas. I think ultimately, at the end of the day, I think he will respect science. I think he will move forward with science, and I think that he'll be good for the health of America.
Okay, Grant, you've been very patient. Thank you for that. You're a big fan of RFK. I've got to say, I like him personally. I've enjoyed interviewing him. He's a very smart guy. That is without any doubt. I think he's a smart guy. He's a big thinker. And frankly, I always say to people, I've been saying this a lot recently, if you look at pictures from New York or LA or Miami or anywhere you like from 1920 and you compare them to today, what do you see? No fat people, right? You just see a bunch of fit-looking people, albeit with a smaller health span expectancy because of disease and so on. But Americans, like the British, have just got very fat and immobile with all the disease that comes with that. They're eating crap food in the main and so on. And here you've got a guy, RFK, who's 70-odd. He looks very fit himself, so he practices what he preaches. And he just wants to think differently about what America is doing to itself with food. I mean, that alone, as Deborah said, I think is a good way to start, isn't it?
Hey, look, I mean, all you got to do is look around the country, just like you said in your opening, 355 million people. Most of them look older than they are. They're definitely overweight. You got autism breaking out in this country at great rates, infertility, sperm counts down. Infant mortality goes on and on and on. Anybody that does not want to confront that with new eyes, like your self-described journalist down there in the red, it seems to be here just to antagonize, not solve a problem.
Self-described entrepreneur.
ADD, ADHD, depression levels. I think 25% of the country's on some kind of medication that's below 25 years old. And we consume more medication in this one country with 350 million people than the entire planet combined. And anyone that doesn't want to confront that, like Robert Kennedy is, and by the way, he helped get Donald Trump voted in as a mandate. The country wants change, and it is willing to confront the status quo.
I also think with him, Francesca, there are some, definite disingenuous attempts to misrepresent him. I asked him categorically, is he anti-vaccination, period? And he said absolutely not. And in fact, his own kids have been immunized against various things. He's very skeptical, as many people are, about the COVID vaccines, particularly the mRNA vaccines. I was with, for what it's worth, one of the top cancer experts in Britain for lunch a couple of days ago, who was utterly scathing about the long-term impact of the mRNA vaccines, Pfizer and Moderna, and says that they're reaping a whirlwind in the world of cancer, for example, as a result of the vaccines. Not to say that I personally believe they saved many lives, but did we have enough time to examine the potential consequences? Almost certainly not. So he's been skeptical about that, but he's not anti-vaccine, as many people like to portray him.
Except that he founded an organization, the Children's Health Defense League, that is straight up against vaccinations. They are selling onesies for babies that says, you know, unvaxxed and unafraid, right? Like, that's what they're doing. They're an anti-vax organization. That's what he has done for decades now. I just want to name, like, trust me, if we think that ripping people's psychiatric meds away is going to be beneficial for the health of this country, you have another thing coming. We are going to see.
Actually, I do think it's a good idea. Well, hang on.
Drug epidemic.
Hang on.
Hang on. We're gonna.
No, you hang on. You hang on. To answer that point, I do. America is ridiculously over-medicated, particularly in the area of antidepressant drugs and anxiety drugs and so on. And Britain's going the same way.
No, I think it's great. I think it's great.
There are millions of young people.
You know what happens?
Hang on, Francesca. Hang on. Don't start shouting.
A private little
Don't start shouting.
Let me just
finish. Let me put a question to you.
I bet money that Francesca's on drugs right now.
Francesca, let me put a question to you.
Not
hang on, guys. Hang on. Can you both please hang on?
What happens is,
Francesca,
people's medications away.
Can't stop.
Let me make a point, please.
Hey,
let me make my
Piers,
point.
Can I just
Let
say
them
for a minute,
respond.
I feel like I'm.
Everyone stop talking for a moment.
I'm on a panel.
Francesca, the point I'm making is America has 80% of the world painkiller consumption. 80%, right? You have millions of don't respond yet, millions of young people who are taking completely unnecessary, mind-bending drugs for things like anxiety, depression, often self-diagnosed. And guess what happens? You then have a load of weirdo, loner kids running around with their brains scrambled who commit mass shootings and stuff like that. There is a direct correlation. And we're going the same way in Britain. Young people are getting massively over-medicated. So I am actually in favor of RFK trying to pull America away from its addiction to mind-bending drugs.
There's a real life example for what happens when you kick people off of painkillers, which I agree. Painkillers were overused, specifically the Sackler family, when it comes to OxyContin, right? We all know this infamous case got millions of people addicted to OxyContin when they didn't need to be on such a heavy opioid, right? And so what happened? Rightfully, doctors started rescinding those scripts, which was good, but then people were already addicted. So they sought painkillers on the black market, which were mostly just heroin, opioids, fentanyl, and whatnot. And ask anyone who studies these issues, it made it worse. Meaning we need to understand that when you just rip meds, when you rip meds away from people, no. When you rip meds away from people, you actually have to have some kind of fallback that helps them and rehabilitates them. Otherwise, they go to the street to buy street drugs. Everybody knows this. It's well proven. But again, what do I know? I'm not trying to hawk supplements. Here's what I'll say.
Can we just go back to talk about the health issues? Because I think I'm really hoping that we can have that discussion, because I think, and I really appreciate you all being open-minded, that he's bringing a new tone to the investigation and really talking about diagnosing disease early. And I love the AI approach. We have reams of data in our electronic medical records, and we're not using them. Data should be used, and we can anonymize it, and we can look at what people's risk factors are, and we can do so much with the information we already have, and we can find solutions. I hear you talk about Texas and the immunization rates there. That issue is in one of our very culturally special groups in West Texas that has had a vaccine exemption for decades. It's in, we all know our Amish and Mennonites have always historically been vaccine hesitant. And I think, so don't group that situation in Texas with the rest of the country. And let's remember what he said in the hearing. He made it very clear to every mom out there that his children were immunized about childhood vaccines. Yeah. And what we've done wrong in public health is we didn't explain that COVID vaccines were nothing like the childhood vaccines, and that the childhood vaccines, like many of the diseases, you get it once, you don't get it again. And this is getting the children to have that disease without getting the deadly consequences. That is not what the COVID vaccine was designed to do. It wasn't designed to prevent against infection. And if you look at the vaccine hesitancy rates, they've doubled since COVID. So we have to start addressing these things. We can't just ignore them.
And Deborah, let me ask you, Deborah, I mean, given that you were the face of COVID from the Trump presidency at the time, do you share, this doctor who I was with, do you share the concerns about the longer term negative impact of some of the COVID vaccines?
The messenger RNA vaccine should have been rolled out for the people that were at risk for severe disease, because that's what the vaccine was developed for. But when we say that we're following the science and the data, we need to follow the science and the data. And the science and the data said people primarily over 65 or people with significant comorbidities were at risk for severe disease. Those are the individuals that should have been immunized first. And we should have put our science behind our immunization schedule and protected those most at risk. It went into young people in hospitals before it went into our elderly in nursing homes. That is not following the science and the data. So I am all for following the science and the data, but it shouldn't just be a statement. It should be a reality. And when we don't match what we do in public health to the science and the data, that is when we get into trouble. And that's when we start to fracture trust with the American people.
Okay, Bryan, again, you're going through this extraordinary experiment with your own body. And I guess we'll see, proof will be in the pudding, right? If you're still here in 100 years' time, we're all going to be going the Bryan Johnson route. But if you're RFK right now, what do you think are the biggest priorities for public health in America?
Yeah, I think one is getting the direction correct. I think that if America wanted to become the healthiest country in the entire world, that is the right direction. Right now, I think we're trying to fight over what is the source of the problem. But generically speaking, over 40% of the US population is obese. I recently went to India and I was shocked that the air pollution was so bad. It was like smoking 4 cigarettes per day, but nobody had an air purifier, nobody had a mask. And I thought, how is this possible if they are so normalized to such a tragedy? I mean, babies are breathing this air. And I came back to the US and I saw almost everyone I saw was obese. And I thought, we have the same problems here, and I'm normalized to it. I couldn't see it. I'm oblivious to it. So I think we have a very serious problem. We are a terribly unhealthy country. It is bad for our work. It is bad for our play. It is bad for our family. It leads us all to be manic. It is a really terrible situation. So what I'm hopeful for is this is a wake-up call for all of us, that we can come together in a goal that we want to be the healthiest country in the world. And we have the fortuitous situation that we have the best technology in the entire world. If we can actually incorporate technology into our healthcare system in a way that's sensible and practical, I think we really could lead the world. So to me, I'm very bullish on this. But I mean, this is my first panel, I have to say, and I'm not very good at jumping in and making inflammatory remarks and like talking over people. So I need to get better at this. But I mean, I think really this is like a really cool moment for us as a country, for us to find a new purpose for existence.
Yeah,
Why is it, do you think, that we're so unhealthy? That's my question. Is it because we're one of the only developed nations without universal health care? Is it because millions and millions of Americans die every single day because they don't have access to a doctor?
Spend more money per civilian.
I'll tell you this. I have been.
Yes, we do. Because
hang on.
don't have access to
health care. Don't talk about it. Grant, I'll bring you in a moment. But Bryan, just to respond to that, the universal health care.
So over the past 4 years, 4 years ago, I posed this question: are we the first generation that won't die? Now, in any previous generation, it would have been absolutely crazy to pose that question. Of course, death is inevitable. At this moment, though, in the speed at which AI is developing, I think it is the first time in human history where you can ask with a sober face that we may be the first generation who won't die.
I agree.
Now, doing that, I've become the most measured person in the world. And we have measured everything, every biological age of every organ in my body. Also, we've measured the toxins in all foods and all supplements. I can tell you, I've learned the outcome is food is guilty until proven innocent. The toxin load in our foods is insane. So no, you don't think that access to a doctor
helps you stay alive?
So wait, hold tight. No. Like, why do you interrupt so much?
Why do you?
Because I'm like trying to get to the point. I asked you a very specific question, and you're repeating how you're never gonna die, and all the blood boys that you have on on lock, or like nobody cares, man. We're not as rich as you to live forever. People want to be able to see a doctor. People want to survive when they get a diagnosis. People want to get access to meds and not go bankrupt. Medical bankruptcy is the leading cause of bankruptcy in this country. Don't you know that? Or are you too rich to sort of like X yourself out of that situation?
Matt, you are really a rude person. I was
actually enjoying his answers.
You're welcome.
Yeah, Bryan,
someone should be rude, man. Someone should ask you hard questions. This guy's not going to.
Francesca, let him answer. Let him answer. Bryan.
Thank you. I appreciate that very much. My goodness. So what I'm saying is we have tested foods of all types, and the toxin load in the U.S. food supply is horrific. It is really, really bad for everyone's health. Now, when you're consuming toxins every day, when children are, adults are, and you don't have control over that, just like breathing bad air, you really get sick. And so is it the case that you don't have a doctor? Is that the problem? Or is it the case that you've got a toxic food supply that's filling you full of these things every single day? And so what I think would be cool is if we did something like we mapped the US food ome, just like the genome, if we actually mapped 80% of the foods that Americans eat on a daily basis and measured the toxins in the foods. What does the average baby consume on a daily basis of mercury and lead and arsenic? What does the average person consume for BPAs and phthalates and microplastics? To me, that would be like an investigative act where we get a baseline. What is the toxic load of each person? Then does that explain metabolic disease? Does it explain obesity? Is it explaining why there's so many mental health problems? Maybe.
Yeah, I think these are definite questions to be asked. And the other thing, Grant, to bring Grant in, on the issue of what Brian said about people maybe not dying. You know, I was with Elon Musk last summer. He talked about the humanoid robots that are coming, the Optimus program. And I'm told that the kind of midway step is that you're going to end up with half human, half robot, a bit like the old $6 Million Man TV series, right? Where you get something wrong with you and you get a kind of mechanical upgrade. And slowly you're sort of becoming part human, part robot, but you could potentially just stay alive. Now, whether that's a good thing.
I mean, that's coming.
Yeah, I think it is coming. I mean, there's no question. We look at these robots now, and you think about a human having stuff repaired in a robotic way, where they still have human dimensions but have a lot of robotic stuff in them. That makes perfect sense to me. Why wouldn't we end up like that in 30, 40 years?
I do think you should be half robot, Piers. I think that would be enough.
How do you know I'm not already, Francesca?
Honestly, we don't have the evidence that you're not.
Well, the rate that you interrupt people suggests you're not entirely human.
Me interrupt?
Yeah. Grant.
Yeah, look, I'm 67 years old. I'm interested in living longer, but I'm also interested in feeling good while I'm doing it. And I know while we appear to have an extended life, most people are not happy in those last 10, 15, 20 years. I know people are not happy in their 40s. I know guys half my age that can't do anything. They can't do, 20-year-olds that can't do push-ups, sit-ups, can't put, like, this is basic. Let's go back to our education system and teach good health. Let's teach the American families they're eating garbage like Brian talked about and the doctor did. We're eating fucking garbage, okay? It's garbage. And if you're not going to confront that it's garbage, the sugars we consume today are different than the sugars that I was brought up on. I don't know scientifically what's different, but there's something different about the sugar I consume today than when I was in 1960. And so anybody that doesn't want to have these conversations, the idea that we have 26 prescription meds per household in this country is insane. And they're also contributing. So I'm curious about the connection, particularly from the doctor, the connection between big pharma and big food that's keeping.
Well, that's a really good question. So Deborah, I mean, there's no doubt that there are a lot of people with vested interests in not sorting this problem out. People who make crap food and want to pummel it to hundreds of millions of Americans. The pharmaceutical companies, I mean, when I read that painkiller stat, I went to my local Rite Aid, I think it was, in LA, and there was just row after row after row of painkillers, all different brand names. But when I looked at them all, they were all the same thing, exactly the same, all had exactly the same, pretty much the same stuff in them. They were just being packaged and marketed and sold in a different way. This is an obscene thing going on, where America is gigantically over-medicated and pharmaceutical companies are making gazillions feeding that addiction. I mean, never mind the bad food, that is also a big problem.
Well, that's why I think we are in an inflection point. a combination of what Bryan talked about, of utilizing the data we have today. We do have healthy people in this country that we can really study. We've got to study the positive deviants and the negative deviants. We got to study the people who are doing really well and understand what they're eating and how they're eating and how we get to that space. And we have to understand that we see every day the people who aren't doing well. And certainly obesity is part of it. But what we found in West Texas, we had more diabetes than we had obesity. So there also is a genetic predisposition. So it's about, and I don't want everyone to feel guilty about obesity because so much of it is linked to the food that they had. So I think without guilt, we really need to approach this in a comprehensive way.
I'll tell you how bad it is. I'll tell you how bad it is, right? I've got a house in LA, and when I buy bread in London, and I'm not saying we're the gold standard at all, when I buy a loaf of bread in London, after about a week, it starts to mold and go off, and you can't eat it. In LA, that loaf can be sitting there for 6 weeks, 2 months, and it doesn't change. That's not right. That means there's so much. There are so many preservatives in this thing. None of that is right. That's just a loaf of bread.
I agree with you guys. I super agree. And I think this is where we need to come together. Like, honestly, I agree with Grant and I agree with Bryan. I agree with Piers and I agree with Deborah. I agree with all of you. But we're talking about big pharma and we're talking about big food, big agriculture, right? And the unspoken powers behind those are corporate power, corporate money. And the real question is this: will RFK Jr. in an Elon Musk presidency be able to actually regulate and break up big agriculture and big pharma? My guess is no. If you say yes, look, let's say our prayers, but I don't think in this administration, RFK, who, let's be real, initially wanted to serve in the Kamala Harris administration, was asking her for a job. When she didn't give him any, play, he went over and asked Donald Trump, and Trump was like, okay, I'll reverse everything I've said about you. So if we're going to go after the corporations that are doing this to our food supply, I'm all for it. Sadly, what's happening instead is that right now, under Musk presidency, we are stripping away Americans' basic access to food in the form of Meals on Wheels that feed seniors, in the form of SNAP benefits that does include healthy meals. And the more money you give to SNAP benefits, to Meals on Wheels, healthiest vegetables, green leafy vegetables, all the vegetables you need. But vegetables are more expensive than, yes, cheap carbs and McDonald's and all that. We know that. But if you actually fund those programs, which right now President Musk is defunding all of those programs, people aren't eating healthy. Another thing is Medicaid. Medicaid provides healthcare to poor and low-income Americans around this country. Millions, hundreds and millions of people in this country. 40% of all births are covered under Medicaid. At this point, the only way to birth a healthy child is to accept some of Elon Musk's semen that he keeps on hawking around. Shout out to Ashley St. Clair,
who was a guest on Uncensored only last week, extolling the virtues of Elon Musk. So there we are. That brings us full circle. Look, it's a fascinating debate. I will actually be really intrigued to see what RFK does. I don't think he's a lunatic. I think he's a smart guy who's thought about these things very carefully, very deeply. I'm not saying I agree with all of it, but I certainly think that conventional wisdom about all these issues has clearly failed. America is unhealthy. So all the conventional politicians who've looked at this in the last 50, 60 years have failed Americans. So why don't we give him a chance? Let's give him a chance. See what he does.
Universal healthcare. Universal healthcare.
What was that?
Universal healthcare. Just healthcare.
Well, we have that here, as you know.
You're not confronting the problem.
All I will tell you is if you fall off a segway in England, you will get free healthcare to repair your broken ribs and collapsed lung. When I fell off one in LA, I had a bloke in a white coat leaning over me in the accident and emergency room, asking me to fill in a form to guarantee I could pay for what he was about to do to me.
I know.
So Francesca, my point is, I need no persuasion. I need no persuasion that we have a better system. Like so many things in life, the Brits have got it right. No, we haven't.
How long
here comes the monarchist.
Well, actually, you know what? We had one great queen for 75 years who was beloved around the world and deeply respected. Can you say the same about all the presidents you've had in that time? No. If you kept your monarchy, is there a good chance you could have had King Piers by now? Yes. Would that have been a good thing for America? Absolutely.
All right, now
that was
you
a
are
joke.
a robot.
You said the backdrop
Now
was-
you are a robot.
Listen, it's a great debate. Let's keep having it. Lovely having you all on the random panel, but we got to a point of agreement. I'd rather end there rather than ruin things. So let's end with an agreement on the big picture. Let's get America healthy again. Nice to see you all. Thank you. Piers Morgan Uncensored is proudly independent. The only boss around here is me. If you enjoy our show, we ask for only one simple thing. Hit subscribe on YouTube and follow Piers Morgan Uncensored on Spotify and Apple Podcasts. And in return, we will continue our mission to inform, irritate, and entertain. And we'll do it all for free. Independent, uncensored media has never been more critical, and we couldn't do it without you.